are now in the final time about this. So we need the kind of audits that you're talking about and then the kind of information that you're talking about. We're really interested in that, and I look forward to working with you on it.
Great. Well, thank you. And, one of the things we're also concerned about is the real threat of retirement of so many providers in the physician workforce. And, as we look particularly of how that's going to impact patients, particularly in rural communities, many of the communities lack specialists, and particularly with the number of physicians at an older age in our rural communities. And we're seeing now more patients are approximately seeing 50% more specialists than in year 2000. And so I wanted to see if there's things that you're doing in administration to help ensure that our rural patients can get access to some of these specialty care.
I think one of the most important things that we've done to address that very, very grave problem is the site neutrality rules, which we have recently finalized, and that will end the disparity between what's paid to rural providers and what's paid to urban providers, and hopefully dampen the appetite for consolidations, which are destroying rural economies and rural healthcare, and allow them to get a living wage, which they don't have right now.
Right. Well, thank you. Thank you for all your hard work. I yield back.
Ms. Sanchez.
Thank you, Secretary Kennedy. We appreciate your appearance here today. To win the support of skeptical senators during your confirmation hearings, you claimed, and I'm quoting here, "I support vaccines. I support the childhood vaccine schedule." I was skeptical about those comments because prior to your nomination, you espoused numerous disproven theories that childhood vaccines, including the measles vaccines, were linked to autism, death, and other adverse effects. Not surprisingly, we were right to be skeptical of your promise to support the childhood vaccine schedule because at your direction, the CDC removed its universal vaccine recommendations for children, covering 7 immunizations, including things like flu, COVID, hepatitis A, hepatitis V, and rotavirus. On Fox News last year, you stated, and I'm quoting you again here, "There are adverse effects from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes." A deadly measles outbreak in Texas killed an unvaccinated 6-year-old, the first such death in a decade. So simple yes or no question. It's not that we don't want to let you answer, it's that we all have limited time, and you have plenty of time to answer questions, and you had plenty of time to give testimony at the beginning. So simple yes or no answer will do here. Do you agree with the majority of doctors that the measles vaccine could have saved that child's life in Texas?
It's possible, certainly.
Okay, thank you. I want to look at some very important data. In 2024, under the Biden administration, which apparently seems to be responsible for every ill in the world, in 2024, under the Biden administration, there were 258 cases of measles. And in 2025, under your leadership at HHS, it ballooned to over 2,000. That's a 675% increase. And we are now on track to surpass that this year with over 1,600 confirmed cases in just 3.5 months. If we project those numbers out for all of 2026, we can expect a whopping 6,400 cases of measles. That's a 2,380% increase in a preventable disease. CDC data also shows that about 80% of children who died from flu this season were not vaccinated. The anti-vaccine rhetoric you ran on and the anti-vaccine actions you have taken over the last year clearly correlates with the dramatic increases, again, in preventable diseases. As a mother, this horrifies me. Stopping the spread of communicable diseases is one of HHS's primary responsibilities, and a strong public health messaging campaign on the importance of vaccines could have stopped this surge of measles cases as it had in past outbreaks. But I was appalled to learn that the CDC suspended public health messaging on vaccines last February. It ended a successful flu vaccine campaign as well. My question is, did President Trump approve your decision to end CDC's pro-vaccine public messaging campaign?
You got a lot of misinformation there, first
No,
of all.
I'm asking you a question. I
Let me
appreciate a
respond
response
to the
the question.
misstatements that you've made.
No, you have other opportunities. I have limited time.
I only have,
Please
you're
answer my
the only
question.
opportunity I have
Did
to
President Trump approve
respond.
your decision to end CDC's pro-vaccine public messaging
Let
campaign?
me, allow me to respond to a lot of the misinformation.
No,
that
answer
you
my
just-
question, please, sir. I have limited time.
There's a global measles epidemic. We've done better in preventing
There's
it than
no
any country
there
in
is
the world.
no country that has seen a bigger percentage increase.
That's not
than
true.
this.
Mexico has 3 times our
Did you-
measles, and
did
they have
President
1/8 of our
Trump approve
population.
your decision to end the CDC's pro-vaccine public message?
Canada has double
Was
the
that a
measles, and
decision
they have
that was made
1/3
by
of
Trump?
1/8 of our
Did
population.
he approve that?
We've
and
done
it-
better at preventing measles than any country in
Did
the world.
President Trump approve your decision to end the CDC's pro-vaccine public messaging campaign?
We've done better at preventing
That's
measles.
not answering my question.
and ending
sir.
the epidemic
That is
than
not
any
answering my
country
question. And
in
I
the
think you don't
world.
want to answer the question because I think you know
I want to
that
respond
you
to
are
your
making
misinformation.
terrible decisions that impact very real lives, especially the lives of children. Now, one thing that I find incredible is that you suspended this pro-vaccine messaging campaign, but somehow you're spending taxpayer dollars to drink milk shirtless in a hot tub with Kid Rock. And somehow you think that's a better public health message
Your time is
than
expired
informing
by a
the
minute.
public about the importance of vaccines?
Gentlelady's
Really?
time is expired.
Really? I yield back.
You don't have anything to yield. Mr. Smucker.
Thank you, Mr. Chairman. Thank you, Secretary, for being here today. I'd like to first, thank you for your work. Thank you for your willingness to do this. Thank you for your courage, because taking on entrenched systems does take real courage, and I think future generations will thank you for the work that you're doing today. I want to talk just 2 quick things. You've spoken extensively about the role of diet in preventing chronic disease, and I have 2 specific policies, bills that I'm working on that we've talked with the department about, but I'd love to get your public comments about them today. The first is food as medicine interventions, like produce prescriptions, medically tailored meals, which there's growing evidence that they can really improve outcomes for patients with chronic disease. So I think there's a role for these approaches in federal health programs. And of course, you know, CMMI is created specifically to test new healthcare delivery models that improve outcomes, lower costs. And I appreciate that under your leadership, CMMI has started to prioritize prevention-focused models. So I've been working on and plan to introduce actually this afternoon a bipartisan bill that would test a bundled payment that provides certain chronically ill patients with a comprehensive package, access to healthy produce, nutrition counseling, remote monitoring, with the goal of preventing disease progression and reducing avoidable healthcare costs. Just like to get your reaction to that, and love to have the continued support of the department for a policy like this.
I mean, we have the highest chronic disease burden in the world. The congressman was talking about the deaths from infectious disease, which are a couple of thousand a year. 90% of the people who die, the 3 million people who die in this country, die of chronic disease, and nobody's paying attention to this. And all of these members have ignored this for as long as they've been in office. This is the real threat to American health. In fact, during COVID, we had the highest death rate of any country in the world. And when you ask CDC, why is that true? They say, well, it's because we're the sickest population. The average American who died from COVID had 3.8 chronic disease. Well, what was killing them, COVID or the chronic disease? You have to understand, chronic disease, infectious disease has a very hard time killing a healthy person. It kills people with chronic disease. And I'm looking forward to, you know, up to 70% of type 2 diabetes can be reversed, and people can even lose the diagnosis simply by changing their diet.
Yeah. Well, thank you. I do want to bring up one additional piece of legislation that we're working on. Food manufacturers are moving in the right direction due to your leadership on reducing additives, reformulated products, responding to consumer demand for healthier options. There's still a gap, though, in what's in the generally recognized as safe or GRAS pathway, where companies can self-determine a substance is safe. They determine that themselves, often relying on their own expert panels with limited transparency into potential conflicts of interest or underlying data. So that's another piece of legislation I'm working on. I think we should establish clear standards for self-GRAS panels, strengthen public confidence in our food supply. Just wanted to get your thoughts. Do you believe reforms like that are?
Yeah, that's absolutely critical. We have finalized in my agency a closing the GRAS loophole, and that regulation is now going through the interagency process. We're a little bit hobbled in what we can do, and Congress can do much more. So my office would love to work with your office on getting a much stronger bill, much stronger regulations. The GRAS loophole has been hijacked by the food industry. And because of that, we have 10,000 ingredients in our food. In Europe, they only have 400. And most of those have never been safety tested. We don't even have a list of them. We have no idea what they are. It essentially allows the industry to put in any chemical they want, any chemical they devise in lab into our food without even the slightest regulations. And that needs to be changed if we're going to make America healthy again. I appreciate your help and your leadership, Congressman.
Thank you. Look forward to working with you on that.
Ms. Sewell.
Mr. Secretary, you've made a number of outlandish and frankly disturbing comments both before and during your tenure as Secretary of Health and Human Services. I want to draw your attention to one of those times. In a 2024 podcast interview, you suggested that Black children on ADHD medication should be reparented. You said every Black kid is now just standardly put on Adderall, SSRI, benzos, which are known to induce violence, and that those children are going to have to go somewhere to get reparented. There is a lot to unpack in that comment. I know that you've already answered several of the questions I was going to ask, and so I'm just going to rephrase them. Mr. Secretary, you've already admitted that you are not board certified physician, and you've already admitted that you did not go to medical school. Have you ever reparented, or parented, I should say, a Black child?
I don't even know what that phrase means, and I doubt
just
that
a yes
I
or
said
no
it.
answer.
I doubt that I said
say
that
it.
phrase. No,
Absolutely
I'm not going to
said it.
answer something that I didn't say.
You absolutely said it.
Oh, I'd like to hear the recording.
So to be
Because
clear,
it doesn't
sir,
make any
I'm
sense.
I'm
I don't
gonna
even know
reclaim
what
my
it
time.
means.
I don't either. That's why I'm asking.
And by the way,
So to be
of
clear, you're not a
26
doctor, you have no medical degree, and you have no formal medical training.
As
you
have-
have never
as have-
parented a
as
Black
have
child. And yet you
24
are
of the
suggesting
26
that
HHS
government-
secretaries
Mr.
have not had
Secretary,
medical
This is my
degrees.
time. And I say to the chairman, I want to reclaim my time. So you are not a doctor, have no formal medical training, and you've never parented a Black child, and yet you are suggesting that the federal government should take Black children away from their families and reparent them and send them off to some wellness farm instead of providing them with evidence-based
You're just
medical
making
care.
stuff up.
I am absolutely not making this up. Mr. Secretary, in your opinion, what factors should the federal government consider when reparenting a Black child who has been on ADHD or ADD?
I don't even know what you're
rhetorical,
talking about, Congressman.
I
don't know what you're talking
deficit,
about. I don't know what
deficit
reparenting
disorder,
even
and
means.
I don't either, but you said that.
I did not
Mr.
say that.
Secretary, for Black families in the United States, the issue of family separation is not new. Our nation has a long and painful history of separating Black children from their families. During slavery, Black children were taken from their parents and sold with no regard for their humanity. And after slavery, Black families continued to face forced separations through Jim Crow laws, discriminatory policing, and child welfare systems that too often assume that Black parents were unfit. Even today, Black children are removed from their homes at higher rates than white children, not because of their greater harm, but because of long-standing bias and built-in institutionalism. For you to suggest that Black families are not capable of raising their own children is deeply offensive. Sir, you are the Secretary of Health and Human Services for the world's most powerful country, and your words matter. When you suggest that reparenting Black children, when you sow doubt about the safety of vaccines, and when you promote unproven statements that have no basis in science, you endanger the lives of everyone across this nation. Those children have parents. And to suggest that they have to be reparented is offensive.
I never suggested that.
Your words matter. When those words are careless, communities pay the price. When your words are imprecise, they create confusion. And when your words are dismissive, they cause real harm. So you don't have the pleasure, because of your position, to speak first and think later. Not in this job and not because of your responsibility.
I expect,
and the American people expect, that you choose your words with sincereness and with seriousness, the seriousness that your position demands. American lives are at stake, and it's time that you start acting like it, sir.
Thank you. Ms. Hearn. Mr. Hearn. Mr. Hearn.
Thank you, Mr. Chairman. It's good to be with you today. Mr. Secretary, thank you so much for, sorry. It's good to have you here today. I really appreciate it. I want to use my time to bring an issue to your attention. Last month, a young man from Oklahoma, Jacob Toe, came to meet me in my office. He told me a story that stuck with me, and one that can make a huge difference for children in our country. In 2024, Jacob was in the midst of a custody dispute for his 3-year-old son, Leonardo, or Leo as they called him. One day, Jacob got the call no parent ever wanted to receive. While Leo was in his mother's care, the young boy passed away. Jacob learned that Leo died from an accidental ingestion of fentanyl that was left within the reach of his mother's home. Jacob fought to figure out how this could possibly happen. In doing so, he learned that the drug screening panels used in the child welfare process did not test for fentanyl, which is not detected by standard drug panels. While talking to lawmakers back home, they, like me, were shocked that fentanyl was not already included in the child welfare drug screenings. I believe other states across the country do not realize this gap in care and safety exists. While grieving the death of his son, Jacob decided to get involved. He told his story all around the state of Oklahoma, urging lawmakers to correct this deadly gap in testing and keeping kids safe. Thanks to Jacob's effort, last month the Oklahoma State House of Representatives passed Leo's Law in honor of young Leo. This bill requires the Oklahoma Department of Human Services to include fentanyl testing in all child welfare drug screenings where fentanyl use is suspected. This is not an issue that is unique to Oklahoma. Other states, such as California, have followed suit and introduced similar legislation. I'm proud of my home state for leading this charge, and even prouder of this young man from Kellyville, Oklahoma, who has turned his unthinkable tragedy into successful advocacy efforts. I commend Jacob, but I know he cannot do this alone. We must do our part and help him ensure that no other child is harmed from fentanyl like his son Leo was. Secretary Kennedy, 2 things. Will you work with Congress to educate states about this ongoing issue and hopefully get them to introduce laws, and figure out how we can work together at the federal level to ensure all states are testing for fentanyl and child welfare drug screenings when necessary?
I will work with your office on that. I think it's a wonderful objective. As you say, it's normally regulated by state law, but we can look at other options.
It would be great to get everybody to do this. I'm sure children are dying across the country. Like I said, even California saw the need to do this and pass their own laws. One other question before I go. Substance abuse is one of the leading factors for kids entering foster care. And in fiscal year 2024, more than 30% of children entered foster care due to substance abuse by their parents. Under your leadership, ACF has expanded access to drug treatment under the Title IV-E Child Welfare Program for parents as part of the Great American Recovery Initiative. What steps can Congress take to build on this administrative's emphasis on prevention services?
Well, we've now funded as part of the Great American Recovery Plan a STOMP program. We're working with states, with law enforcement, with detoxes, with rehabs, and sober housing to bring together a treatment that has been fragmented and atomized in the past. We also, one of the primary problems with drug treatment is it has the same reverse incentives as we see in the main, in the physical health medical system, which is that people get paid more by keeping the addict addicted. If you go to a rehab and you relapse, that's the best thing that'll happen to that rehab, because then you're coming back for a second bite. And we're now working on implementing a model, and I actually visited a place in Arizona called Camelback this week that guarantees where the rehab, after you go there for 30 days or 60 days, will guarantee if you relapse within the next 12 months, you come back for free. And that gives the rehab the incentive to make sure you're going through IOP, that you're getting drug tested, that you're getting psychiatric care, that you're going to 12-step meetings or whatever they need to do to maximize, because their financial incentives are now aligned with the incentive of getting you healthy. And I think ultimately that's where we need to move toward value-based care rather than essentially what's a fee-for-service model.
Right.
Thank you, Mr. Secretary. Mr. Chairman, I will not yield back time because I don't have any to yield back, just to point that out. Thank you.
Thank you, Mr. Hearn. Ms. Del Bene.
Thank you, Mr. Chairman. Mr. Secretary, I'm glad you're appearing before us today. Under your leadership, CMS recently added new layers of red tape that Medicare patients need to navigate to get the care that they're entitled to. Mr. Secretary, I hope you understand the harm that delaying and denying necessary care can have. Do you remember saying this, quote, "Americans shouldn't have to negotiate with their insurer to get the care they need. Pitting patients and their doctors against massive companies was not good for anyone," end quote. Do you remember?
I don't remember, but I would align with that.
And I'll submit for the record actually a press release from CMS with your quote in that from June 23rd of 2025.
Without objection.
In this case, I agree. Pitting patients and their doctors against massive companies isn't good for anyone. And yet, less than a week after you said that, CMS announced the Wiser model. The program allows private companies to use AI to review traditional Medicare claims and pays them based on the amount of care they deny. This program went into place in 6 states across the country, including my home state of Washington. President Trump said multiple times on the campaign trail that he would not cut Medicare, but this program does exactly that. For example, Joanne is a senior from Washington on Medicare. She has a herniated disc that is pinching her sciatic nerve, causing immense pain down the right side of her body. Her doctor prescribed an injection that would help relieve her pain. If it had been prescribed last year, she would have received the treatment, no problem. But because of the Wiser model that has been implemented, she's been in intense pain for over 6 weeks while she waits for approval. She has been using crutches or a wheelchair for over a month now, which is making her arthritis worse, adding to her chronic pain. Since using crutches, she's fallen multiple times, including earlier this week. Instead of simply approving the procedure, Joanne's conditions are getting worse. And Secretary Kennedy, the W in the Wiser model stands for wasteful. Do you think that Joanne's treatment, which would allow her to walk and live with less pain that her doctor has prescribed, do you think that's wasteful?
Do you want me to actually answer that question?
Yeah.
I think that that's a terrible outcome. It's one that was not intended by the system, obviously. The problem is there's tremendous ways. In Medicaid, there's only 5% of the cases are given prior authorization. and private industry 30%.
This is traditional Medicare now, where
Medicare.
it's now, this is only been put under prior authorization under your leadership. Now, President Trump promised multiple times that he, quote, will not lay a finger on Medicare. Given President Trump's promise, did you or the president approve this model, which is now delaying and denying care for people in states like the state of Washington?
And can I answer the question?
Yeah,
So
people are being denied care across our state
I'll
right
say
now.
very, very quickly. And this is an example. 5 years ago, we were paying $250,000 a year for $250 million for skin substitutes. This year, $23 billion. Why? Because there was no prior authorization in the Medicare program.
And now someone like Joanne is not getting her
now-
care. It's more expensive for us because Joanne is not getting her care. We have story after story. I can also submit for the record stories of all the people who are being delayed and denied care. It is more expensive for us. It is more expensive for them when they are not getting the care they need. Last year, I sent CMS a letter detailing my concerns about the Weiser model. I still have not gotten a response. That was last August. Can you publicly commit to responding to that letter and addressing the concerns of this harmful model?
Yeah, absolutely, we will. And I apologize for not getting back to you sooner. We have an unprecedented number of communications from Congress.
Well, we don't have you
each
here
one of
very
them-
often. We have people in my state who are being denied care, who are being hurt based on this policy, and there's an indifference to the challenges that they are facing, all because of a model put in place for no reason and doing exactly what you said shouldn't happen, which is, and I quote, pitting patients and their doctors against massive companies. These are private companies doing this prior authorization. It was not good for anyone. Thank you.
As I
yield
said,
back, Mr. Chairman.
discovering $23 billion worth of fraud is not for no reason. And that
You are hurting patients in our state and other states across the country for no reason, and I appreciate you finally responding to the letter. Thank you. I yield back.
Ms. Miller.
Thank you, Chairman Smith. Secretary Kennedy, thank you so much for coming in front of our committee today and for your leadership in improving the health and well-being of the American people. I have two things I'd like to discuss. In my home state of West Virginia, we see some of the highest rates of chronic disease in the country. Coupled with our rural nature and limited access to care, many of these patients are especially vulnerable and face significant barriers to managing their conditions. The first chronic disease that I want to speak about is our patient population that I am focusing on, which is people who are living with chronic kidney disease and the end-stage renal disease. I commend the administration's effort to promote affordability and fiscal responsibility in healthcare. I am concerned, however, that in the case of kidney disease, the current ESRD bundle may inadvertently discourage the development of adoption of new therapies and technologies that could improve outcomes and reduce long-term costs for patients who do rely on life-saving dialysis. The complicated post-TDAPA policy has resulted in promising innovative drugs being pulled from the market entirely or only being accessible by a tiny fraction of the patients. I have a bill called the Kidney Care Access Protection Act, and it is a piece of legislation that could expand access to the new treatment options in a way that both encourages innovation and ensures costs remain well managed for Medicare and taxpayers. As we work together toward better outcomes and cost containment, how is CMS evaluating ways to strengthen incentives for innovation within the ERSD bundle while still maintaining fiscal responsibility?
I mean, I would say that that's the balance that we're all trying to achieve. We are doing everything in our power to maintain the United States as the innovation center for the world. And we want to make it easier to get quick approvals for drugs that actually work. We need to do science on them and we're doing gold standard science, and we have depoliticized science at the agencies. I don't know enough about the renal disease aspect in the bundle, but I'm happy to work with you. Also get somebody from Oz's team to come over and talk to you directly, because I know that that's not an outcome that they would like.
That would be wonderful. The second issue that I wanted to talk to you about is that it is clear that what we eat plays a direct role in our health. And quite frankly, many Americans don't eat right. And these poor nutrition choices are a major driver of chronic disease. I believe there's a strong case of expanding access to MNT therapy for targeted and specific groups in Medicare beneficiaries whose outcome could actually measurably improve as a result. With that in mind, can you share your perspective on the role medical nutrition therapy should play in improving health outcomes for Medicare beneficiaries, and how we can most effectively and responsibly expand to those who would benefit from the most, particularly in the rural and underserved areas?
Yeah, I think, and I've worked with Governor Morrissey about that on this issue, and I think there's nobody at this agency who is not committed to the idea that food is medicine, that it is, and if we want to do prevention in this country, we've got to, and end the chronic disease epidemic, we've got to start with food. That's one of the reasons we're pushing nutrition into the colleges, we're pushing it into the hospitals, we're pushing it into the community health centers, make it the central focus of healing and prevention. I want to work with you in any way that I can to achieve the goals that you're talking about.
Thank you so much. I yield back.
Dr. Murphy. I don't think your mic is working.
Oh, nope. Use this one.
All right. Is it now? It's working now. Thank you for coming. I want my 12 seconds back. Thank you for coming. You know, we're talking about a little bit about vaccination. I think we ought to talk a little bit about the arrogance of a fellow named Anthony Fauci, who came and lied to Congress, lied to the American people, and in my opinion, destroyed the confidence of the American public in the healthcare system. So I think that when we're talking about vaccination, that's number one. Number two is your predecessor, who was not a physician either, led the greatest invasion in this country of 13 to 20 million illegal people coming in this country who were not vaccinated and brought in disease into this country. So let's actually bring facts into that conversation. Second of all, I share some of the concern now about what's happening with our drug delivery system going to China. They are developing a burgeoning industry that is threatening what we do as primal confidence, at least in the American pharmaceutical industry. And I think we really, really have to be concerned about that. I think the greatest thing that your administration has done is bring highlighting to the fact that food is medicine. I saw a child in my clinic about 6 weeks ago that was 8 years old that weighed 262 pounds. This is what we're dealing with. This is what the obesity epidemic, and it is sad that the number one drug that is selling now in the country are weight loss drugs. This is endemic. This speaks to the terrible, terrible tragedy that has become the American food industry. So thank you for highlighting that. I want to get back to one thing that is my passion, and that is the cost of care in this country. The cost of care in this country has risen tremendously, in my opinion, primarily because of vertical integration that has happened in this country, primarily which has been caused by the ACA. That is the number one driver of healthcare costs. We can talk about the pharmaceutical industry, we can talk about the other things. But we, a few weeks ago, had the arrogance and the vanity of our health insurance industries come in front of this committee and just sit to point fingers otherwise. You convened last summer, in July, the 70% of those who insured in this country, and they said they were going to do better. And I know they gave a report saying they've cut down prior authorizations by 11%. But frankly, after 35 years in the healthcare industry, I don't believe a damn word that they say. And until we get the middlemen under control in this country, the number one driver of healthcare costs in the pharmaceutical space is not the pharmaceutical industry, it is the pharmacy benefit managers, it is the middleman. And until we get rid of this thing that is only present in the United States, we will not drive down healthcare costs. And so I urge you to be the hallmark of your administration is to go after what we have created, is the vertical integration that is destroying the doctor-patient relationship and bankrupting America. Second of all, I want to talk about the No Surprises Act. To your point, absolutely, a great bipartisan, bicameral bill. Your predecessor, of course, went straight and gave all the authority to the insurance companies. I have a bill, HR 4710, which puts meaningful enforcement back into this. Right now, our vain and arrogant insurance companies are keeping hundreds of millions of dollars just in their little kitty, which has been appropriated to people who provided the care, but they're keeping it. And so enforcement mechanism, and I understand your administration is working on that. So I thank you with this. And then lastly, excuse me, I applaud the Trump RX. We had Mark Cuban come in. We're working with the administration and trying to do this with Cost Plus. I saw a patient, again, about 6 weeks ago. He changed insurance companies. The pill he had been on for 15 plus years was now close to $1,500. I literally pulled out my phone and went to Cost Plus, and it was $15. So I applaud the administration for getting the middlemen out. These are the problems that the American public is facing. You know, we can talk about all the other extraneous issues, but if people can't afford health care, that's not access to health care. When you allow 20 million people in the country and you overload hospitals and you overload of healthcare systems, we can't provide care to the American public. That is our primal and first duty. So I want to say thank you for what you're doing. You have a tough job. We're here to support you and thank you for your efforts. With that, I'll yield back.
Ms. Chu.
Secretary Kennedy, we have a child care affordability crisis in this country. Working families are having to pay skyrocketing prices, in some cases as much as 40% of their income. And too many working parents are having to leave the workforce or turn down job opportunities because they can't afford child care. This is hurting American families, our workforce, and our economy. During your 2024 presidential campaign, you did a commendable thing. You a bunch of extra data not required by law, and also the president's budget request for 2027 proposes eliminating $350 million for preschool development grants. Do you agree with eliminating $315 million from preschool development grants?
Those funds are going out, they're not being withheld. You're mistaken about that.
No, this proposal, actually what I said was
Mistaken about that.
No, this proposal, actually what I said was the elimination of $315 million for preschool development grants. I'm just wondering, because it's completely contradictory to what your presidential campaign, affordable. President Trump campaigned in Iran. So remember, Mr. Secretary, you once said for the cost of the Ukraine war, we could make childcare affordable for every family. It's ironic that Trump is doing the exact opposite, not funding childcare because we have wars to fund. It's a slap in the face to every American. And now I'd like to switch to another topic, hepatitis B. Today, I'm thinking about my friend, Chi Moy, who was a city council member in my district, San Gabriel, California. Chi did not know that he had hepatitis B until he donated blood, eventually 3. It was beyond tragic. But to think his life could have been saved had he been vaccinated from hepatitis B as a newborn. Secretary, you've done an incredibly harmful thing to our community. You eliminated the mandatory hepatitis B vaccine for newborns, and it disproportionately threatens Asian Americans because while we make up 7% of the population, we account for 60% of all hepatitis B cases. It's clear that this administration has no regard for the health, safety, and well-being of Asian American communities, as well as communities across the United States.
You want me to reply?
Well, if that's,
Hepatitis
Do it
B
quickly, yes.
is a terrible disease. But babies are not at risk unless they essentially have zero risk, unless their mother is infected. For all, mothers are tested when they go into the hospital to have a baby. And for all those people who are infected, the vaccine is still a recommended vaccine. For everybody else, it's available. Parents can assess the risks themselves through informed consent. Insurance will pay for it. We did not remove the vaccine from being insured. And we just believe that Americans should have that choice, that the state should not make that choice for them. Hepatitis B vaccine was not safety tested. It had a 4-day test with no placebo. We don't know what the risk profile is, and parents are allowed to ask that question.
Mr.
the
Kustoff.
science is that it's not simply about choice, it's about whether infants are protected during the most vulnerable period.
Infants are protected. Those
Okay,
at risk
Mr.
are protected.
Kustoff is recognized.
Thank you, Chairman Smith, and thank you, Secretary Kennedy, for appearing today. If I could, Secretary Kennedy, I represent parts of Memphis, Jackson, Tennessee. You and I have talked about Jackson, Tennessee before, and rural West Tennessee. I wanted to talk to you about hospitals, particularly in those rural communities. I know that because of the CMS Area Wage Index, we have hospitals that are in primarily rural areas that are being paid less than those in urban areas. During the president's first term, CMS did introduce the low wage index hospital policy, and that did help to reduce that discrepancy. Back on March 26th, a few weeks ago, I introduced with Congresswoman Terry Sewell a bill called the Save Struggling Hospitals Act. So it is bipartisan legislation. It aims to keep rural hospitals open by codifying an adjustment to the area wage index to ensure that hospitals in rural and low-wage areas receive a fair Medicare reimbursement for the essential services that they provide. I know that you have publicly said before that you support codification of the low-wage index hospital policy. I guess I just wanted to ask you, that is something that you still support and you would support being codified?
Absolutely. I wish that we could fix it within the agency, but as you know, the Social Security Act requires that any adjustment has to be revenue neutral. And that means if you take from one area, you have to give to another. If you give to one area, you have to reduce payments to the other. It's a broken system. It needs to be fixed, but only Congress can fix it. And I and my agency will work with you toward that goal.
Thank you, Mr. Secretary. If I could ask you about peptides. A lot of attention with peptides. We know that about 3 years ago, the FDA removed 19 peptides from the list that compounding pharmacies could routinely make, and that limited access. Can I get your general opinion on peptides and your agency, your department's plans, if there are any, for maybe mainstreaming peptides?
Well, we returned 12 of those peptides yesterday. The class, to the Category 1 categories, so that formulators will now be able to formulate them. Peptides are like supplements. The FDA has authority to require pre-licensing safety studies, pre-marketing safety studies in any drug that claims a specific indication and that's mass marketed. If you don't make those claims, if you're not mass marketed, then FDA does not require that. So like supplements are not regulated in that way by FDA. Peptides are not supposed to be regulated. It's been upheld again and again by the courts. The Biden administration improperly moved them to Category 3 without any evidence of safety. The only The only justification they have is if there's a safety concern, and there was no science that indicated a safety concern, so it was improper. We have now remediated that by moving them back.
Thank you very much, Mr. Secretary. And I'll yield back, Mr. Chairman.
Thank you, Mr. Fitzpatrick.
Secretary Kennedy, in a long overdue move, the FDA is finally taking steps to remove petroleum-based food dyes, including red 40, yellow 5, yellow 6, blue 1, blue 2, and green 3 from our food and our medicine starting immediately. These dyes have been unequivocally linked to cancer, to hyperactivity, and to so many other serious health risks, and yet they have been left unchecked and unlabeled for absurdly too long. Secretary Kennedy, beyond commitments from industry and beyond regulation from the FDA, what steps can this legislative body take to make sure that we preserve over the long term cleaner ingredients in our food and our medicine as we look to address the link between these chemicals and the chronic disease epidemic?
The most important thing that you could do, Congressman, is to close the grass loophole. We have regulations now that do everything in our power, my agency's power, to close that loophole, and those are now in the interagency process, so we've completed it within my agency. There are now other agencies of equities in them and are looking at them, but it doesn't go far enough, and we need to go farther. We need to really make sure that any ingredient in our food is safety tested first. That's what they do in Europe. That's what they do in other nations. That's why they only have 400 ingredients in their food in Europe compared to 10,000 here. And so that we would love to work with you on that legislation. I think it's absolutely critical if we're going to make America healthy again.
Second, I want to address something that is of critical importance to my constituents in Bucks and Montgomery counties in Pennsylvania, pertaining to the chronic disease epidemic, pertaining to the impacts of PFAS and microplastics in our food and our water supply. There is more that can be done at the federal level to address chemicals and toxins in our food and water, and elevate how these issues are connected to deteriorating health across our nation. Specifically, the recent joint announcement that HHS and the EPA will be including microplastics in the EPA's contaminant candidate list and launch the ARPA-H program to detect and remove plastics from the human body, I believe to be a positive development in addressing the intersection of toxins in our food and water and the chronic disease epidemic. Secretary Kennedy, could you expand on the agency's efforts to further address microplastics and PFAS contaminants in our food and water supply, and how these actions will impact overall health and fighting the chronic disease epidemic?
We're putting $140 million into the STOMP program at ARPA-H to track, right now, microplastics, the average American has a teaspoonful of microplastics in his brain. Almost 1% of brain volume is now microplastics. That couldn't be a good thing. We know very little about the pathways by which it goes into the brain. There are hundreds of components in microplastics, hundreds of different kinds. Some of them may be benign, other ones we know are hideously toxic. We are going to identify those. We're going to trace the pathways so that we can better regulate them. The other thing that we're doing is moving them to the MCL, to the maximum contaminant list in the Safe Drinking Water Act, so that we can now start regulating, establish maximum contaminant levels for both PFAS and microplastics, and start regulating them effectively in drinking water. I want to add this, that the amount in our brains has doubled over the past 5 years. So this is rising exponentially, and it is an existential crisis.
Thank you, sir. I yield back, Mr. Chairman.
Thank you. Ms. Moore. Ranking Member Moore.
Thank you so much, Secretary Kennedy. And I just want to join in with the committee and sort of, remembering the Kennedy family. I remember being 9 years old, begging my Republican mother to vote for John Kennedy. I don't think he won in Wisconsin, but I do think that your family has made a great impact on this country. I promise to give you easy, comfortable questions if you don't yell at me and hurt my feelings and overtalk. I promise you. I just want to thank you for pointing out stuff like the dyes and stuff in food, and maybe even looking at the food pyramid. I think that's been a very helpful discussion in terms of your making America healthy again. And I'm just going to ask you a question, and I hope it's sort of outside of the scope of your service. But how does the $1.4 billion cut in WIC and the $900 billion cut in SNAP interfere with your Make America Healthy initiative? I know that departments are told they have to cut. Do you think that will interfere?
Well, am I happy about the cuts? No, I'm not happy about the cuts.
Don't you think it will? I mean, Fruit Loops are a lot cheaper than good, healthy food.
Yeah, nobody wants to make the cuts. Russ Vought doesn't want to make the cuts. President Trump doesn't, but we got a $39 trillion debt. And that's costing every American child $6,600 a year.
Yeah, I get that, sir.
Okay,
so it is my time. Thank you.
All right, thanks.
And I am, I'm focusing on children here. You made a beautiful quote that I was not aware of in your testimony. You said, although children may be the victims of fate, they will not be the victims of our neglect. You claim your uncle said that. What uncle were you talking about?
I think
John F. Kennedy Jr.?
President Kennedy.
President Kennedy. Although I just thought it was just classic. And so I just, when we start putting things on the chopping block and cutting stuff, I would have hoped that we would not have started with our children. And I just want to know how that statement, that attribution to President Kennedy fits in with, cutting completely Healthy Start, which is a proven program that has decreased infant and maternal mortality. I don't get it. It just contradicts that whole notion of not neglecting our children or firing 20,000 people in your department with consolidations that give technical support and help develop state plans around TANF, the Social Service Block Grant. These are the most vulnerable people and kids. I mean, even cutting $43 million out of the free diaper care sort of program. And I'm just making a statement. I'm not asking a question, not confronting you, but I took all these notes while you were talking to other people, so I just had to kind of address them. I am wondering how your Make America Healthy Again program fits in with the National Database for New Hires. It's a federal database maintained by your office for the purposes of assisting child support agencies. Very sensitive information, and Section 453 says that you will only use the data. How does giving that data to ICE support your mission at HHS?
Well, all the things that we do in terms of data sharing comply with the law.
No, this doesn't comply with the law, specifically Section 453. I would love to see the General Counsel's memo on this, if you wouldn't mind submitting that, because
I'm happy to submit it.
Please, and let the record reflect that he will give us that letter, because it is definitely in contravention of our laws. And I want to thank you for your indulgence and thank you for appearing here.
Well, thank you for the respect and the kindness of your presentation.
Thank you, sir.
Mr. Stubbe.
Thank you, Mr. Chairman. Mr. Secretary, the contrast between the Trump administration and the last administration cannot be more striking. On issue after issue, when your predecessor came before this committee, he was defiant and claimed ignorance. In March 2024, I questioned then HHS Secretary Becerra about the Office of Refugee Resettlement's process for finding replacements, placements, and shelter for unaccompanied migrant children. Of the more than 100 questions submitted by this committee, my question to him about missing children was one of only 2 questions that your predecessor declined to answer. The Biden administration's open border policies were nothing short of a lethal disaster for our country. Let's be clear about the facts. The Biden DOJ received thousands of allegations of sexual abuse related to unaccompanied minors processed through ORR. Under the Biden administration, ORR permitted individuals with criminal records, no citizenship, and who refused a background check received custody of unaccompanied children. Over the course of 10 months alone, the agency lost contact with nearly 20,000 unaccompanied children. Under the Biden ORR, case managers failed to perform home studies on more than 95% of placements of unaccompanied children. And finally, grand jury testimony in my home state of Florida revealed unaccompanied children were placed in the custody of convicted felons in homes with multiple unknown male occupants. This is unacceptable. Becerra's refusal to even acknowledge the issue when I brought it up to him is disqualifying. That is why I introduced the Stop Gaps Act with Senator Moody that builds up upon the Trump administration's success on securing the border by requiring the ORR to work with state and local authorities to guarantee safe and proper vetting of all individuals and entities before granting them custody of an unaccompanied child. Under the Trump administration, the border is secure, crimes from illegals are being stopped, and there are rigorous standards in place to better protect children. Mr. Secretary, can you speak to the work that your agency is doing to combat our social services being taken advantage of by bad actors and the increased safety of our children?
Yeah, I mean, it was a humanitarian crisis, what my predecessor engineered with the Biden administration. They lost 425,000 children. They lost them because they ended verification of sponsors. People were just showing up with fake IDs. There was no genetic testing. There was no income inquiries. There was no ID validation. And we are now in the process of trying to find those children. We've been able to locate 138,000 of them. They're very, very difficult to find. Many of them, as you say, have been trafficked. They've undergone slavery, sexual abuse. We found one sponsor who picked up 42 children, and their address was an empty container in a parking lot. And there was no effort. And in fact, the administration, Mr. Becerra specifically ordered people in my agency to end the verification process. They were more interested, they explained that the objective was to move kids out of custody as quickly as possible. Well, they made a lot of mistakes, but now, thanks to President Trump, the amount of unaccompanied minors has dropped by 97%. We have beds now for 7,600 unaccompanied minors, and only 2,000 of those are filled. We hold them until we can completely verify the people who picked them up are actually family members, and that has never happened during the last 4 years.
Well, thank you for your service to our children and to the unaccompanied minors and the changes that you have made from the previous administration. I yield back.
Ms. Tinney.
Thank you, Mr. Secretary. Really appreciate your service and your great responses today. I just wanted to commend you first for your very sensible position on vaccines. I too am a fan of the greatest tennis player in the world, Novak Djokovic. I see you got to play tennis with him. When Javier Becerra, who
I lost, by the way.
Yeah, not surprised. Who can? When Javier Becerra was here, I asked him, I was trying to get a waiver for Mr. Djokovic to be able to play in the US Open at the time, the #1 tennis player in the world, and still I would argue the greatest ever. And he described to me that they would not give him a waiver for because he did not take the vaccine because it was science, although a lot of other American tennis players were allowed to be there who were not vaccinated. So thank you for your common sense approach to choice and pro-safety as opposed to being anti-vaccine. I'm glad you clarified that today. But I wanted to jump to a really important issue in my district and especially in the state of New York. During the COVID crisis in upstate New York, nursing home residents were isolated from their families for months, sometimes years, and Governor Cuomo disgracefully called it protecting them. But the reality is that people declined rapidly in isolation and in most cases died without a loved one present. That wasn't protection, it was a policy failure of enormous consequence by Governor Cuomo and his administration that cost lives to thousands of seniors, not to mention the deadly nursing home order that he required nursing homes to take COVID-positive patients where they didn't have the ability to handle these patients. Sadly, many of those same bureaucrats responsible for carrying out this disastrous policy are still working in Governor Hochul's administration. That's why I, along with my co-sponsor, Representative Larson, Fitzpatrick, Panetta on this committee, and numerous others, have reintroduced what's called the Essential Caregivers Act, a bipartisan, bicameral legislation that guarantees nursing home and long-term care residents the right to in-person access to a designated family caregiver, even during a public emergency. It also directs CMS to establish clear, uniform safety protocols so visits can continue safely. Families and friends are visitors. They are loving caregivers, and they advocate, they catch things maybe that a nurse or staff would not, and cutting them out of the facilities didn't protect the seniors, it actually accelerated their decline. I was wondering, because of this situation and the isolation of so many nursing home residents, which contributed to serious physical and cognitive decline, independent of the virus, by the way, given the department's guidance and generous access for designated caregivers in nursing homes, do you share the view that maintaining family access during emergencies is a patient safety issue and not just a quality of life issue?
Absolutely, and we made a lot of mistakes with the countermeasures during the COVID pandemic, including shutting down the schools, shutting down businesses. Those things kill people, and that's one of the reasons, in my opinion, that we had the highest death rate of any nation in the world. We lost 3,000 Americans to COVID for every million population. There were other countries, Haiti, for example, had 14 per million population. So Nigeria, 14 per million population. We had 200 times the death rate of other countries. We had 10 times the death rate of Europe. And a lot of it was just because of bad policies that were not science-based, and we are not going to do that under my watch. And one of the reasons that I think blacks were much more likely, most likely to die, was because depriving them of access to a family member, their hospitals and their neighborhoods already closed. Depriving them of access to a family member meant that there was a reduced incentive within the hospital to provide them with the kind of good care that they needed.
My time has expired, but can I just ask you, would HHS support codifying a federal right for essential caregivers and giving them access?
I personally would support that. My agency will work with your staff.
Thank you. We appreciate it.
Legislation.
Thanks so much for your testimony. I yield back.
Mr. Boyle.
Thank you, Mr. Secretary. I'm over here. Thank you. I'm hoping this can be constructive and have a conversation with you. I have the honor of representing an incredibly brave constituent and proud fellow Philadelphian, LaTanya Morrison. Her grandson, Ahmaud Butler, tragically died of a rare form of brain cancer at just 6 years old. Last year, she and her family marched 179 miles on foot from Philadelphia to Washington, D.C., to bring attention to the critical need for childhood cancer research funding. I met her right outside here on the Capitol steps and had a wonderful but also heartbreaking conversation with her, and have been working with her and her family since then. Specifically working with her on a proposal called the Ahmaud Butler Childhood Cancer Hope for a Cure Act, to make sure that no grandparent, parent, or loved one has to go through what she and her family experienced and continue to experience this day. That hole in her heart will never go away. So my concern is, and I have no doubt that you have concern for this constituent I just described and all those who particularly have lost a child to this horrible form of cancer. But at the same time, your administration, or you as secretary in this administration, are carrying out hundreds of millions of dollars in cuts to cancer research funding. So I was wondering if you could explain why you're doing that, and does that really get us anywhere closer to getting a cure that we all want to cure this horrible disease?
First of all, thank you for sharing that heartbreaking story. And, the worst thing that can happen to a human being is to lose a child or a grandchild. And it's something that I hope that I never have to experience. And my heart goes out to that family. The one agency that within my agency, and the only agency within NIH that actually got a budget boost from our proposal, was NCI. And we're absolutely committed to cancer research, and particularly pediatric cancer research. I invite you, Congressman, to call me to tell me if there are programs. Some of our programs were duplicative, so we've moved them around, and it looks like there was a cut, but I don't know of any major cancer studies that have been cut. I'm happy to talk to you about it. You reach out to me.
If you could, after this, sorry, just because we're time limited, and I have under a minute now. So I appreciate that, and if our staffs could follow up, or you and I directly with one another after this, and I would just ask, if I could get your pledge, not for me, but for my constituent, if I could get your pledge that you will work with me, my staff, the White House, to get the president to declare childhood cancer a national emergency, which would, as you know, help unleash additional resources and really focus the attention that we need on childhood cancer.
Yeah, in theory, I like the idea. Let's talk about the details. We've already done, the president already signed an executive order on pediatric cancers. I was there at the time. So I need the devil's in the details, but in theory, I absolutely support that proposal, and I'm happy to work with you and your staff on it.
Thank you, and I yield 0 time back.
Mr. Chairman, I seek recognition to ask unanimous consent to enter into the record the exact transcript of Secretary Kennedy's remarks that we discussed regarding the reparenting of Black children.
Without objection.
Thank you.
Ms. Fishbach is recognized.
Thank you, Mr. Chair. And Secretary Kennedy, I'm over here. I know it gets confused. There's lots of us and we're running around a lot. And I just want to tell you, thank you so much for being here and thank you so much for your willingness to answer questions. It always amazes me that people even agree to come to these committees because we have you sit there on the hot seat for hours on end. We all get to run around, get coffee, whatever it is, and the witness is sitting there. So I genuinely appreciate that you're here and that you're answering questions very honestly and frankly.
My staff did not tell me that I had a choice.
Okay, well then, fair enough.
I am happy to be here.
Well, thank you very much. And just so you know, I'm from Minnesota. I represent a rural district, and I think you know rural Americans face heightened healthcare challenges. While nationally, healthcare is seeing increasing staffing costs, staffing shortages, and increasing wait times. All of these problems are amplified in rural areas where care is already more limited. And I know that we counteracted that with the Rural Health Transformation Program in the Working Families Tax Cut Bill last year. And significant funding was to strengthen the healthcare in small towns across the country. I know in my office and in other Minnesotan offices, we sent letters of support to CMS in favor of the application and the funding. But the Rural Healthcare Transformation Program alone is not enough to solve those rural healthcare issues. And so I am wondering if you could just talk a little bit about what's the administration's plan to reduce health disparities in rural areas, and what specific actions are you taking to ensure quality and affordable rural healthcare remains a priority within HHS?
I mean, we've already finalized rules for site neutrality. I think that will help. The administration would love to work with Congress on the wage area index, which I think also will help. And then, we are continuing. We made the biggest investment ever in history on rural health care. We're continuing to make additional investments. I mentioned I think $135 million that I allocated for community health centers last week. And so this is a priority for the president. It's a personal priority for me. And, if you have ideas of other things we ought to be doing, we'd like to hear them.
Well, and Mr. Secretary, I appreciate that because it is such a critical part of, and like I said, representing a rural area, healthcare, having the access to that healthcare. And I know that Mr. Estes had talked a little bit about specialty care in rural areas, but it is absolutely critical for the survival of our small towns and the health of our individuals who live there, that we have healthcare available. And I think some of our provisions for telehealth and things like that have really moved things forward. But I just sincerely appreciate the ability that your offer and we have worked with the department, and so I appreciate that. And I'm actually going to yield back 35 seconds.
Thank you. Mr. Moore. I'll take that 35 seconds if I can.
I didn't give it to you.
Yeah, I understand. Sir, the most important thing you said today in Congress, that Congress has allowed $39 trillion of debt, and so that's forced you and your agency and your amazing team, some of which I know are very debt-focused. Mr. Andres, you had to tighten your belt. I just want to say as an American and as a member of the Bipartisan Fiscal Forum, I can't thank you enough for doing your part. Doing the hard part to be able to find redundancies. You'll get criticized for it, but it matters, and every agency needs to be doing it. So thank you for that. I've mentioned to you in private how much I appreciate the administration's focus on autism. You may recall my 10-year-old Winnie is neurodivergent on the autism spectrum. He's the joy of my life. But that's tenfold for my wife and for his younger, older, and twin brothers. And I want to just highlight that I'd never had a ton of expectation on what we could uncover from scanning the pre-existing research. And look, I've always appreciated the administration's focus on this, though. But I was underwhelmed with what we ultimately put out. My wife was hurt, and she felt for a split second until she came to her senses, and we talked about this, that there was any way she was responsible. We don't even know if she took Tylenol during her pregnancy, but that was a hurtful moment for her. And I just want to encourage the administration and your team to keep at it. And I think there's more we can do here. With low expectations, I don't expect much to be able to figure out what the ultimate causes are. That's not an easy thing to do, but I do think there's more that we can do, and we can build past what I was ultimately underwhelmed with. So again, thank you for the administration's focus, and I think we can do more. Regarding something that's very important legislatively, I introduced HR 5343, the Ensuring Patient Access to Critical Breakthroughs Product Act, which builds on one of the biggest wins from the Trump administration. We didn't fully get it implemented, but the MCIT was a significant policy for Medicare coverage for breakthrough medical devices. This bill requires CMS to provide temporary medical coverage for treatments or devices that receive breakthrough designation from the FDA. If a treatment can meet the FDA's burden of proof of safe and effective and other requirements for breakthrough designation, there's no reason Medicare shouldn't be able to provide temporary medical coverage while CMS completes its review for permanent coverage. And this is a brainchild of the Trump's first administration. We've talked about this. We all agree in principle about this. It's difficult to move in some cases, but can you update this committee on your efforts to implement a policy like this through any type of executive rulemaking?
I think, are we in rulemaking on it? We will have an announcement soon, and we're happy to work with you on it.
This is really important and builds on the success from the Trump first administration. There is, as I'm learning too, the FDA and CMS, they operate in parallel, they operate in tandem, and sometimes there's different regulatory constraints that they're going with. We've got to be able to work through those. And if that's all this ultimately is just a difference between those two structures, I mean, this is a good policy that will help improve people's lives, and it will keep safe and effective technology it'll enhance safe and effective technology and get that into the healthcare system.
Yeah, and I agree with you, and particularly if it's a temporary payment that can be revoked, that is intended to be temporary. It's not permanent, as you know. It's with a lot of medical devices. we find problems with them later.
We had tons of bipartisan support on this committee. Some that even didn't support it last time are now on board. It's a great initiative, and we look forward to working more with you. Thank you.
You too.
Mr. Byer.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to yield such time as he may require to the ranking member, Mr. Neal.
Thank you, Mr. Byer. Mr. Chairman, I want to make this moment an opportunity to correct a record on the No Surprises Act, which was passed out of this committee with bipartisan support. I wrote that legislation. I know what was in it. And every Republican on this committee at the time sided with me, and we passed it out of the committee unanimously and had a big victory on the House floor. Like any new program, it needs some help for sure, but the notion that the suggestion we heard from the Secretary that somehow that it languished under Biden is simply not true. The national issue here before us, it's still the regulations that were implemented. It created new protections against surprise medical bills for 200 million Americans. Millions of families benefited from what we've done here every single year. This is a victory that Democrats and Republicans on this committee should take credit for, and I yield my time back to Mr. Byer.
Thank you very much, Ranking Member. Mr. Secretary, the Agency for Healthcare and Research and Quality, AHRQ, has been given an essential task by Congress. It's the only federal agency specifically dedicated to improving healthcare delivery for Americans. It was actually a Ronald Reagan creation. Making people's experience with healthcare easier and ensuring that taxpayer dollars are spent on effective, affordable, and safe care. But, Mr. Secretary, your department's budget justification included $106 million in cuts to AHRQ. The White House budget request was $129 million in cuts. The budget appendix listed $116 million in cuts. The budget also lists more than 250 staff at AHRQ, but widely available reports fewer that 100 people remain at the agency. Mr. Secretary, these discrepancies read either as deliberate misrepresentation or basic accounting errors. Can you clarify how many millions of dollars you intend to take away from research designed to give Americans access to the best, most affordable health care?
Thank you for that question, Congressman. Dr. Klein, who is running it, who is a Yale-educated physician, who is running AHRQ, still has hundreds of staff, and the agency is operating.
Thank you. Well, let me shift to the United States facing a mental health crisis. As you know, nearly a quarter of U.S. adults had a mental illness in the last year, reported 30% of high school students. You recently led an agency reorganization. There was a big scare in January where $2 billion was cut from SAMHSA for substance abuse and prevention and mental health. There was a bipartisan outcry and it was restored. But there's also this real concern that there's a gutting of SAMHSA. I co-chair bipartisan the House Mental Health Caucus. We'd love to have a bipartisan briefing on the reorganization. We requested that back in December, and I'd love for you to commit to a briefing for members in Congress of the bipartisan Mental Health Caucus on the current status of the mental health programs at SAMHSA, CDC, and NIMH.
I strongly support SAMHSA. It's a private mental health, and particularly addiction are priorities for me, strong personal interests, but also their national catastrophes. There were termination letters that went out under SAMHSA. That was a mistake. We immediately recalled them within 24 hours, and I'm committed to the continuing operations in SAMHSA. I'm happy to meet with you about it.
Thank you very much, Mr. Secretary. Mr. Chairman, I yield back.
Ms. Van Dyne.
How are you doing today?
I'm great.
I appreciate you being here. And I know a lot of questions have been asked, and some of the accusations have been just outrageous. I have a bunch of stuff I wanted to ask you about, but clarify. Your qualifications have been called into question because you did not father a black child. How many different HHS secretaries have had that privilege?
I've had
It's a ridiculous question, isn't it? You know the answer? 0. Do you know how many Democrat-appointed HHS secretaries have had a medical degree?
I think there may have been, of the 26.
Nope. 0. 0. Not a 1.
In history.
Yeah, not a 1.
I think there may have been 2 with medical degrees.
Yeah. There's a lot going on that your office is handling and doing so well, and we're so proud of. you know, we had, and I'm looking for this photo, we had a previous secretary who I asked questions about what was going on with the waste, fraud, and abuse. And I don't know if you recognize this. I asked Secretary Becerra the same question. What's going on at 14545 Friar Street in Van Nuys, California? Does that ring a bell to you at all?
No, I could guess. Why don't you tell me?
We had over 100 different licenses for hospices.
For hospices?
Yep, right at this address. And we asked him what he was doing about it. Basically, nothing. Can you walk through what your office is actually doing on the waste, fraud, and abuse to make sure that we don't see this
We've already
happening
shut
again?
down 500 hospices in Los Angeles. And incidentally, we haven't had one call from Congress or anybody else about complaining, because clearly these were fraudulent. A lot of these places, you'd say they'd have, they were just invented addresses. They would obtain patient identification, or they would pay people. They were going and giving people in poor neighborhoods flat screen televisions, $600, and then they would enlist them enroll them in the hospice, and we were paying them $6,000. And the interesting thing is, almost none of them ever died. Typically, they stay in a hospice about 18 days. These people stayed forever. Nothing ever happened because they weren't actually there. They were just invented. And it was operated by certain foreign communities, a lot of Estonians and a lot of Armenians, and there's an incredibly great Armenian community in Los Angeles, and very few of them were involved in this, but the ones that were making hundreds of millions of dollars out of fraud and just stealing money from us. I think the cost has been about $5 billion.
And it's ridiculous. And I don't think a week goes by where your office is not uncovering further fraud. And what we're finding in California is now they're going after the people who are uncovering the
What kind of a peace do I mean, and what kind of a peace do I mean, and what kind of a peace do we seek? Not a Pax Americana, enforced on the world by American weapons of war. Not the peace of the grave or the security of the slave. I am talking about genuine peace, the kind of peace that makes life on earth worth living, the kind that enables men and nations to grow and to hope and build a better life for their children. Not merely peace for Americans, but peace for all men and women. Not merely peace in our time, but peace in all time. I speak of peace, therefore, as the necessary, rational end of rational men. I realize the pursuit of peace is not as dramatic as the pursuit of war, and frequently the words of the pursuers fall on deaf ears, but we have no more urgent task. Our problems are man-made, therefore they can be solved by man, and man can be as big as he wants. No problem of human destiny is beyond human beings. Man's reason and spirit have often solved the seemingly unsolvable, and we believe they can do it again. And if we cannot end now our differences, at least we can help make the world safe for diversity. For in the final analysis, our most basic common link is that we all inhabit this small planet. We all breathe the same air. We all cherish.
Minton Sip Mint. Instantly fresh. Oppdag neste nivå av friskhet.
Som verdensledende innen robotgressklipping har vi lansert kabel.
We shall pay any price, bear any burden, meet any hardship, support any friend, oppose any foe to assure the survival and the success of liberty. Every thoughtful we shall pay any price, bear any burden, meet any hardship, support any friend, oppose any foe to assure the survival and the success of liberty. Every thoughtful citizen who despairs of war and wishes to bring peace should begin by looking inward, by examining his own attitude towards the possibilities of peace. Too many of us think it is impossible. Too many think it is unreal. But that is a dangerous, defeatist belief. It leads to the conclusion that war is inevitable, that mankind is doomed, that we are gripped by forces we cannot control. We need not accept that view. Our problems are man-made, therefore they can be solved by man, and man can be as big as he wants. No problem of human destiny is beyond human beings. Man's reason and spirit have often solved the seemingly unsolvable, and we believe they can do it again. Surely the opening vistas of space promise high costs and hardships, as well as high reward. So it is not surprising that some would have us stay where we are a little longer, to rest, to wait. But this city of Houston, this state of Texas, this country of the United States was not built by those who waited and rested and wished to look behind them. This country was conquered by those who move forward, and so will space. We choose to go to the moon in this decade and do the other thing, not because they are easy, but because they are hard. Because that challenge is one that we're willing to accept. The energy, the faith, the devotion which we bring to this endeavor will light our country and all who serve it. And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country.
In Dallas, Texas, 3 shots were fired at President Kennedy's motorcade in downtown Dallas. The first reports say that President Kennedy has been seriously wounded by this shooting. The flash, apparently official, President Kennedy died at 1 p.m. Central Standard Time, 2 o'clock Eastern Standard Time, some 38 minutes ago.
There's only one word to describe the picture here, and that's grief.
What was it that moved this nation so much?
Its youth, grace, beauty, hope, promise. As history goes on, it will stay a very prominent part of its history. It's never going to fade. It is never going to fade.
We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. We choose to go to the moon and we meet in an hour of change and challenge, in a decade of hope and fear, in an age of both knowledge and ignorance. The greater our knowledge increases, the greater our ignorance unfolds. No man can fully grasp how far and how fast we have come. But condense, if you will, the 50,000 years of man's recorded history in a time span of but a half a century. Stated in these terms, We know very little about the first 40 years, except at the end of them, advanced man had learned to use the skins of animals to cover them. Then about 10 years ago, under this standard, man emerged from his caves to construct other kinds of shelter. Only 5 years ago, man learned to write and use a cart with wheels. Christianity began less than 2 years ago. The printing press came this year. And then less than 2 months ago, during this whole 50-year span of human history, the steam engine provided a new source of power. Newton explored the meaning of gravity. Last month, electric lights and telephones and automobiles and airplanes became available. Only last week did we develop penicillin and television and nuclear power. This is a breathtaking pace, and such a pace cannot help but create new ills as it dispels old. So it is not surprising that some would have us stay where we are a little longer, to rest, to wait, if this capsule history of our progress teaches us anything. It is that man in his quest for knowledge and progress is determined and cannot be deterred. We shall send to the moon, 240,000 miles away, a giant rocket more than 300 feet tall on an untried mission to an unknown celestial body, and then return it safely to Earth. But why, some say, the moon? Why choose this as our goal? And they may well ask, why climb the highest mountain? Why 35 years ago fly the Atlantic? We choose to go to the moon. We choose to go to the moon. We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills. Because that challenge is one that we're willing to accept, one we are unwilling to postpone. And therefore, as we set sail, we ask God's blessing on the most hazardous and dangerous and greatest adventure on which man has ever embarked. Ladies and gentlemen, the very word secrecy is repugnant in a free and open society, and we are, as a people, inherently and historically opposed to secret societies, to secret oaths, and to secret proceedings. We decided long ago that the dangers of excessive and unwarranted concealment of pertinent facts far outweighed the dangers which are cited to justify it. Even today, there is little value in opposing the threat of a closed society by imitating its arbitrary restrictions. Even today, there is little value in ensuring the survival of our nation if our traditions do not survive with it. And there is very grave danger that an announced need for increased security will be seized upon by those anxious to expand its meaning to the very limits of official censorship and concealment. That I do not intend to permit to the extent that it's in my control. And no official of my administration, whether his rank is high or low, civilian or military, should interpret my words here tonight as an excuse to censor the news, to stifle dissent, to cover up our mistakes, or to withhold from the press and the public the facts they deserve to know. For we are opposed around the world by a monolithic and ruthless conspiracy that relies primarily on covert means for expanding its sphere of influence, on infiltration instead of invasion, on subversion instead of elections, on intimidation instead of free choice, on guerrillas by night instead of armies by day. It is a system which has conscripted vast human and material resources into the building of a tightly knit, highly efficient machine that combines military, diplomatic, intelligence, economic, scientific, and political operations. Its preparations are concealed, not published. Its mistakes are buried, not headlined. Its dissenters are silenced, not praised. No expenditure is questioned, no rumor is printed, no secret is revealed. No president should fear public scrutiny of his program, for from that scrutiny comes understanding, and from that understanding comes support or opposition, and both are necessary. I am not asking your newspapers to support an administration, but I am asking your help in the tremendous task of informing and alerting the American people. For I have complete confidence in the response and dedication of our citizens whenever they are fully informed. I not only could not stifle controversy among your readers, I welcome it. This administration intends to be candid about its errors. For as a wise man once said, an error doesn't become a mistake until you refuse to correct it. We intend to accept full responsibility for our errors, and we expect you to point them out when we miss them. Without debate, without criticism, no administration and no country can succeed, and no republic can survive. That is why the Athenian lawmaker Solon decreed it a crime for any citizen to shrink from controversy. And that is why our press was protected by the First Amendment, the only business in America specifically protected by the Constitution, not primarily to amuse and entertain, not to emphasize the trivial and the sentimental, not to simply give the public what it wants, but to inform, to arouse, to reflect, to state our dangers and our opportunities, to indicate our crises and our choices, to lead, mold, educate, and sometimes even anger public opinion. This means greater coverage and analysis of international news, for it is no longer far away and foreign, but close at hand and local. It means greater attention to improved understanding of the news, as well as improved transmission. And it means, finally, that government at all levels must meet its obligation to provide you with the fullest possible information outside the narrowest limits of national security. And so it is to the printing press, to the recorder of man's deeds, the keeper of his conscience, the courier of his news, that we look for strength and assistance, confident that with your help, man will be what he was born to be, free and independent. Ladies and gentlemen, the very word secrecy is repugnant in a free and open society, and we are, as a people, inherently.
Wow! Woohoo!
Our hearts and our arms are open to you. May God bless you and cause his light to shine on you and on your companions and your family. Ladies and gentlemen, I proudly present the President of the United States.
I know now why everyone in Texas, Fort Worth, is so thin, having gotten up and down about 9 times. This is what you do every morning. Mr. Buck, Mr. Vice President, Governor Conley, Senator Yarborough, Jim Wright, members of the congressional delegation, Mr. Speaker, Mr. Attorney General, ladies and gentlemen. 2 years ago, I said that, introduced myself in Paris by saying that I was the man who had accompanied Mrs. Kennedy to Paris. I'm getting somewhat that same sensation as I travel around Texas. Nobody wonders what Lyndon and I wear, but I'm glad to be here in Jim Wright's city. About 35 years ago, a congressman from California, just been elected, received a letter from an irate constituent which said, during your campaign you promised to have the Sierra Madre Mountains reforested. You've been in office for 1 month and you haven't done so. Well, no one in Fort Worth has been that unreasonable, but in some ways he has had the Sierra Madre Mountains reforested. And here in Fort Worth, he's contributed to its growth. He speaks for Fort Worth. He speaks for the country. And I don't know any city that's better represented in the Congress of the United States than Fort Worth. And if there are any Democrats here this morning, I'm sure you won't hold that against them. 3 years ago, last September, I came here on the Vice President and spoke at Burke Burnett Park. And I called in that speech for a national security policy and a national security system which was second to none. A position which said not first but, if, when, and how, but first. That city responded to that call as it has through its history. And we have been putting that pledge into practice ever since. And I want to say a word about that pledge here in Fort Worth, which understands national defense and its importance to the security of the United States. During the days of the Indian War, this city was a fort. During the days of World War I, even before the United States got into the war, Royal Canadian Air Force pilots were training here. During the days of World War II, the great Liberator bombers, on which my brother flew with his co-pilot from this city, were produced here. First non-stop flight around the world took off and returned here in a plane built in factories here. The first truly intercontinental bomber, the B-36, was produced here. The B-58, which is the finest weapon system in the world today, which it demonstrated most recently in flying from Tokyo to London with an average speed of nearly 1,000 miles per hour, is a Fort Worth product. The Iroquois helicopter from Fort Worth is a mainstay in our fight against the guerrillas in South Vietnam. The transportation of crews between our missile sites is done in planes produced here in Fort Worth. So wherever the confrontation may occur, and in the last 3 years it's occurred at least 3 occasions, in Laos, in Berlin, and in Cuba, and it will again. Wherever it occurs, the products of Fort Worth and the men of Fort Worth provide us with a sense of security. and in the not-too-distant future, a new Fort Worth product. And I'm glad that there was a table separating Mr. Hicks and myself, a new Fort Worth product.
Of Negro slaves who had been seared in the flames of withering injustice. It came as a joyous daybreak to end the long night of their captivity. But 100 years later, the Negro still is not free. 100 years later, the life of the Negro is still sadly crippled by the manacles of segregation and the chains of discrimination. 100 years later, the Negro lives on a lonely island of poverty. I have a dream that one day this nation will rise up and live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal. I have a dream that one day on the red hills of Georgia, sons of former slaves and the sons of former slave owners will they be able to sit down together at the table of brotherhood. I have a dream that one day, even the state of Mississippi, a state sweltering with the heat of injustice, sweltering with the heat of oppression, will be transformed into an oasis of freedom and justice. I have a dream. My poor little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today. I have a dream that one day, down in Alabama, with its vicious racists, with its governor having his lips dripping with the words of interposition and nullification. One day right there in Alabama, little black boys and black girls will be able to join hands with little white boys and white girls as sisters and brothers. I have a dream today. Exalted. And every hill and mountain shall be made low, the rough places will be made plain, and the crooked places will be made straight, and the glory of the Lord shall be revealed, and all flesh shall see it together. This is our hope. This is the faith that I go back to the South with. With this faith, we will be able to hew out of the mountain of despair a stone of hope. With this faith, we will be able to transform the jangling discords of our nation into a beautiful symphony of brotherhood. With this faith, we will be able to work together, to pray together, to struggle together, to go to jail together, to stand up for freedom together, knowing that we will be free one day. This will be the day when all of God's children be able to sing with new meaning, my country tears of thee. Sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride. From every mountainside, let freedom ring. And if America is to be a great nation, this must become true. And so let freedom ring. From the prodigious hilltops of New Hampshire, let freedom ring. from the mighty mountains of New York. Let freedom ring from the heightening Alleghenies of Pennsylvania. Let freedom ring from the snow-capped Rockies of Colorado. Let freedom ring from the curvaceous slopes of California. But not only that, let freedom ring from Stone Mountain of Georgia. Let freedom ring from Lookout Mountain of Tennessee. Let freedom ring from every hill and molehill of Mississippi, from every mountainside. Let freedom ring in Whitney Capital. When we allow freedom ring, when we let it ring from every village and every hamlet, from every state and every city, we will be able to speed up that day when all of God's children, black men and white men, Jews and Gentiles, Protestants and Catholics, will be able to join hands and sing in the words of the old Negro spiritual, free at last, free at last, thank God Almighty, we are free at last. Of Negro slaves.
Greatest phrases, in my opinion, is the 9 most terrifying words.
The 9 most terrifying words in the English language are, I'm from the government and I'm here to help.
I'm from the government and I'm here to help. I'm here to help. Yeah. One of Reagan's
So first of all, let me assert my firm belief that the only thing we have to fear is fear itself. Nameless, unreasoning, unjustified terror, which paralyzes needed efforts to convert retreat into advance.
Yesterday, December 7th, 1941, a date which will live in infamy. The United States of America was suddenly and deliberately attacked by naval and air forces of the Empire of Japan.
A short time ago, an American airplane dropped one bomb on Hiroshima and destroyed its usefulness to the enemy. That bomb has more power than 20,000 tons of TNT. The Japanese began the war from the air at Pearl Harbor. They have been repaid many-fold, and the end is not yet. With this bomb, we have now added a new and revolutionary increase in destruction to supplement the growing power of our armed forces.
We have been compelled to create a permanent armaments industry of vast proportions. In the councils of government, we must guard against the acquisition of unwarranted influence, whether sought or unsought, by the military-industrial complex. The potential for the disastrous rise of misplaced power exists and will persist. We must never let the weight of this combination endanger our liberties or democratic processes.
I do not believe that any of us would exchange places with any other people or any other generation. The energy, the faith, the devotion which we bring to this endeavor will light our country and all who serve it. And the glow from that fire can truly light the world. And so, my fellow Americans, ask not what your country can do for you. Ask what you can do for your country. My fellow citizens of the world, ask not what America will do for you, but what together we can do for the freedom of man. And there are even a few who say that it's true that communism is an evil system, but it permits us to make economic progress. Lass sie nach Berlin kommen. Let them come to Berlin. All free men, wherever they may live, are citizens of Berlin. And therefore, as a free man, I take pride in the words, Ich bin ein Berliner.
I have a dream that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today. Let freedom ring, and when this happens, when we allow freedom to ring, when we let it ring from every village and every hamlet, from every state in every city, we will be able to speed up that day when all of God's children, black men and white men, Jews and Gentiles, Protestants and Catholics, will be able to join hands and sing in the words of the old Negro spiritual, free at last, free at last, thank God Almighty, we are free at last.
There is no constitutional issue here. The command of the Constitution is plain. There is no moral issue. It is wrong, deadly wrong, to deny any of your fellow Americans the right to vote in this country. To know war is to know that there is still madness in this world. There are poor to be lifted up, and there are cities to be built, and there's a world to be helped. Yet, we do what we must. I am hopeful, and I will try with best I can with everything I've got to end this battle and to return our sons to their desires. Yet, as long as others will challenge America's security and test the dearness of our beliefs with fire and steel, then we must stand or see the promise of 2 centuries crumble.
All we say to America is be true to what you said on paper. But somewhere I read of the freedom of assembly. Somewhere I read of the freedom of speech. Somewhere I read of the freedom of press. Somewhere I read that the greatness of America is the right to protest far right. And so just as I say we aren't going to let any dogs or water hoses turn us around, we aren't going to let any injunction turn us around. Well, I don't know what will happen now. We've got some difficult days ahead. But it really doesn't matter with me now, because I've been to the mountaintop. I don't mind. Like anybody, I would like to live a long life. Longevity has its place. But I'm not concerned about that now. I just want to do God's will. And He's allowed me to go up to the mountain. And I've looked over and I've seen the promised land. I may not get there with you, but I want you to know tonight that we as a people will get to the promised land. So I'm happy tonight. I'm not worried about anything. I'm not fearing any man. Mine eyes have seen the glory of the coming of the Lord.
I have some very sad news for all of you, and I think sad news for all of our fellow citizens and people who love peace all over the world. And that is that Martin Luther King was shot and was killed tonight in Memphis, Tennessee. Martin Luther King dedicated his life to love and to justice between fellow human beings. He died in the cause of that effort. For those of you who are black and are tempted to be filled with hatred and mistrust of the injustice of such an act against all white people, I would only say that I can also feel in my own heart the same kind of feeling. I had a member of my family killed, but he was killed by a white man. But we have to make an effort in the United States. We have to make an effort to understand, to get beyond or go beyond these rather difficult times. My favorite poem, my favorite poet was Aeschylus. And he once wrote, "Even in our sleep, pain which cannot forget falls drop by drop upon the heart, until in our own despair, against our will, comes wisdom through the awful grace of God." What we need in the United States is not division. What we need in the United States is not hatred. What we need in the United States is not violence and lawlessness, but is love and wisdom and compassion toward one another. Feeling of justice toward those who still suffer within our country, whether they be white or whether they be black.
Throughout the long and difficult period of Watergate, I have felt it was my duty to persevere, to make every possible effort to complete the term of office to which you elected me. In the past few days, however, it has become evident to me that I no longer have a strong enough political base in the Congress to justify continuing that effort. Therefore, I shall resign the presidency effective at noon tomorrow. Vice President Ford will be sworn in as president at that hour in this office.
Today is a day for mourning and remembering. Nancy and I are pained to the core by the tragedy of the Shuttle Challenger. We know we share this pain with all of the people of our country. This is truly a national loss. We've never had a tragedy like this. And perhaps we've forgotten the courage it took for the crew of the shuttle. But they, the Challenger 7, were aware of the dangers, but overcame them and did their jobs brilliantly. We mourn 7 heroes. And I want to say something to the school children of America who were watching the live coverage of the shuttle's takeoff. I know it's hard to understand, but sometimes painful things like this happen. It's all part of the process of exploration and discovery. It's all part of taking a chance and expanding man's horizons. The future doesn't belong to the faint-hearted. It belongs to the brave. The Challenger crew was pulling us into the future, and we'll continue to follow them.
There is one sign the Soviets can make that would be unmistakable, that would advance dramatically the cause of freedom and peace. General Secretary Gorbachev, if you seek peace, if you seek prosperity for the Soviet Union and Eastern Europe, if you seek liberalization, come here to this gate. Mr. Gorbachev, open this gate. Mr. Gorbachev, tear down this wall.
Just 2 hours ago, Allied air forces began an attack on military targets in Iraq and Kuwait. These attacks continue as I speak. Ground forces are not engaged. This conflict started August 2nd when the dictator of Iraq invaded a small and helpless neighbor. Kuwait, a member of the Arab League and a member of the United Nations, was crushed. Its people brutalized. 5 months ago, Saddam Hussein started this cruel war against Kuwait. Tonight, the battle has been joined.
Mr. Speaker, Mr. Vice President, members of Congress, honored guests, my fellow Americans. We are fortunate to be alive at this moment in history. Never before has our nation enjoyed at once so much prosperity and social progress with so little internal crisis and so few external threats. Never before have we had such a blessed opportunity and therefore such a profound obligation to build the more perfect union of our founders' dreams. We began the new century with over 20 million new jobs, the fastest economic growth in more than 30 years, the lowest unemployment rates in 30 years, the lowest poverty rates in 20 years, the lowest African American and Hispanic unemployment rates on record, the first back-to-back surpluses in 42 years, and next month America will achieve the longest period of economic growth in our entire history.
Good evening. Just moments ago, I spoke with George W. Bush and congratulated him on becoming the 43rd President of the United States. And I promised him that I wouldn't call him back this time. Now the U.S. Supreme Court has spoken. Let there be no doubt. While I strongly disagree with the court's decision, I accept it. I accept the finality of this outcome, which will be ratified next Monday in the Electoral College. And tonight, for the sake of our unity as a people and the strength of our democracy, I offer my concession.
For the workers who work here, for the families who mourn, this nation stands with the good people of New York City and New Jersey and Connecticut as we mourn the loss of thousands of our citizens. I can hear you. I can hear you, the rest of the world hears you, and the people who knocked these buildings down will hear all of us soon.
And all those watching tonight from beyond our shores, from parliaments and palaces, to those who are huddled around radios in the forgotten corners of the world, our stories are singular, but our destiny is shared. And a new dawn of American leadership is at hand. To those who would tear the world down, we will defeat you. To those who seek peace and security, we support you. And to all those who have wondered if America's beacon still burns as bright, tonight we proved once more that the true strength of our nation comes not from the might of our arms or the scale of our wealth, but from the enduring power of our ideals: democracy, liberty, opportunity, and unyielding hope. That's the true genius of America, that America can change. Our union can be perfected. And what we've already achieved gives us hope for what we can and must achieve tomorrow. This election had many firsts and many stories that will be told for generations, but one that's on my mind tonight is about a woman who cast her ballot in Atlanta. She is a lot like the millions of others who stood in line to make their voice heard in this election, except for one thing. Ann Nixon Cooper is 106 years old. She was born just a generation past slavery, a time when there were no cars on the road or planes in the sky, when someone like her couldn't vote for two reasons: because she was a woman and because of the color of her skin. And tonight, I think about all that she's seen throughout her century in America: the heartache and the hope, the struggle and the progress, the times we were told that we can't, and the people who pressed on with that American creed: yes, we can. At a time when women's voices were silenced and their hopes dismissed, she lived to see them stand up and speak out and reach for the ballot: yes, we can. When there was despair in the Dust Bowl and depression across the land, she saw a nation conquer fear itself with a new deal, new jobs, a new sense of common purpose: yes, we can. When the bombs fell on our harbor and tyranny threatened the world, she was there to witness a generation rise to greatness and a democracy was saved: yes, we can. She was there for the buses in Montgomery, the hoses in Birmingham, a bridge in Selma, and a preacher from Atlanta who told the people that we shall overcome: yes, we can. A man touched down on the moon. A wall came down in Berlin. A world was connected by our own science and imagination. And this year, in this election, she touched her finger to a screen and cast her vote. Because after 106 years in America, through the best of times and the darkest of hours, she knows how America can change. Yes, we can. America, we have come so far. We have seen so much, but there's so much more to do. So tonight, let us ask ourselves, if our children should live to see the next century, if my daughters should be so lucky to live as long as Ann Nixon Cooper, what change will they see? What progress will we have made? This is our chance to answer that call. This is our moment. This is our time to put our people back to work and open doors of opportunity for our kids, to restore prosperity and promote the cause of peace, to reclaim the American dream and reaffirm that fundamental truth that out of many we are one, that while we breathe we hope, and where we are met with cynicism and doubt and those who tell us that we can't, we will respond with that timeless creed that sums up the spirit of a people: yes, we can. Thank you. God bless you, and may God bless the United States of America.
For time and the world do not stand still. Change is the law of life, and those who look only to the past or the present are certain to miss the future. I said, are certain to miss the future.
Oh no, I missed that. Prime Minister Castro, this missile crisis was the last straw. We almost blew ourselves up. Now, we invited you here today...
In good faith?
In good faith. To sort this thing out.
And why is he here? He lost. As I always say, forgive your enemies, but remember their names. Now, gentlemen, as I like to think, in the long history of the world, that there are only a few generations.
Sounds like someone breaking in!
Just a storm, Dick. Sit down.
Oh my God! It appears the Pentagon has been breached.
Zombies. Gentlemen, at times like these, our capacity to retaliate must be, and has to be massive, to deter all forms of aggression. Gentlemen, lock and load.
Viva la revolución! Any last words, Mr. President?
Yes, Jack. Any superlative words of inspiration for our humble troops?
Do not pray for easy lives, my friends. Pray to be stronger men.
Hydra Energetic Shower Gel by
Human Services, Robert F. Kennedy, Jr. The committee has received your written testimony. Human Services, Robert F. Kennedy, Jr. The committee has received your written testimony and it will be made part of the formal hearing record. Secretary Kennedy, you have 5 minutes to deliver your remarks and you may begin when you're ready.
Now? All right. Thank you, Mr. Chairman, Ranking Member Neal. Members of the committee, thank you for the opportunity to appear before you today to discuss the President's fiscal year 2027 budget request. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policy, captured agencies, and profit-driven systems have caused it. Parents across the country demanded change, and we are delivering it. We are ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated
Kennedy, Jr. Human Services, Robert F. Kennedy, Services, Robert F. Kennedy, Human Services, Robert
Shuffle gamer when I was a kid, I want revenge. Shuffle gamer when I was a kid, I want revenge. So yeah, we're gonna
til alle hverdagshelter der ute. Denne uken får du 2 ganger 1 kilo Norvegia gulost til bare 119 kroner per kilo. Da er det fort gjort å spare penger. Velkommen til Coop Rix.
YouTube Premium er reklamefri YouTube. YouTube Music Premium. En hel app kun til å strømme musikk uten avbrudd. Prøv en måte kostnadsfritt. Med YouTube Music Premium kan du nyte reklamefri musikk, offline og i bakgrunnen. Prøv kostnadsfritt.
YouTube Premium er reklamefri YouTube og YouTube Music-appen i ett. Prøv en måned kostnadsfritt.
Med YouTube
Help!